I'll invite the second speaker. Dr. Divya is there. Yeah, she'll be talking about the Bleomycin boost.
Good evening, everyone. I'm Dr. Divya Srivastava from AIOCMT3, and I'll be presenting on the topic Bleomycin boost, transforming eyelid reconstruction. So this is a case report of a 60-year-old male who presented with a right lower lid swelling, which was painless, progressive, and gave the typical look of a rodent ulcer. Our patient was also a chronic BD smoker and alcoholic. On local examination, a 4 into 2 centimeter growth was noted, which had rolled out margins and pigmentation and madarosis. So a provisional diagnosis of basal cell carcinoma was made, as we can see. So since our tumor involved more than 3/4 of the lower eyelid area, it was a large size tumor, what we planned for our patient was a debulking with intralesional bleomycin injections and then followed by a wide excision and lid reconstruction. But before this, a histopathology sample was taken and a diagnosis of BCC was confirmed. So the main question before us was that, can it prove to be useful in a tumor of this large size? A short note about bleomycin. It is an FDA-approved anti-cancer drug which has been used for various ocular and non-ocular tumors like squamous cell carcinomas, Hodgkin lymphomas, basal cell carcinoma, Kaposi sarcoma, non-responding capillary hemangiomas, and orbital lymphangiomas. It is a glycopeptide antibiotic and anti-neoplastic drug which acts by inhibiting the G2 phase of the tumor cells. The main adverse effect is bleomycin pulmonary toxicity and skin pigmentation, but very less side effects have been noted with its intralesional use as yet. So how we do it? It is available as a 15 IU injection, and we reconstitute it with a 15 ml normal saline to make it 1 IU per ml. And depending on the size of our tumor, we decide the dose, how much is to be given. So for our patient, we decided to give 2 international units per setting using the multi-puncture technique, as we can see. So the results, with the first injection only, we got very drastic improvement in the size of the tumor and debulking. This was the postoperative 1-month picture, and we went for another 4 doses. This is the 3-month picture, and this is the final result after 4 doses at monthly interval, 4 months apart. So now the patient was to be taken up for surgical excision of the remaining growth. So the question before us was that what procedure we need to do right now. So ideally, we advise the patient to go for a cutler blade procedure, which is a 2-stage process, 4 to 8 weeks apart, as we can see in this another patient with upper lid meibomian gland cancer. But our patient was reluctant for this surgery because of its long visual compromise, which he could not afford. So in view of the progress with the intralesional bleomycin injections that we got, we wanted to plan something else for our patient. So as you can see, the current lesion the patient has, it spares the punctum as well as the canaliculus, which we confirmed by doing a syringing, which was patent. And the lower lid margin was also intact. The lesion was also not very much deep. And the patient was reluctant to give consent for the cutler blade procedure, and he was also very compliant with his follow-ups. So what we planned was a wide surgical debridement with intralesional bleomycin injection, and we wanted to see the result, how the patient responded post-operatively with this. So these are the post-operative results. This is the post-operative day 1 picture. As you can see, another thing that we did was we put a frost suture on the lower eyelid in view of the iatrogenically created ectropion, and we put it for 3 weeks with traction. This is a post-operative 3-month picture. We can compare with the results we get with the cutler blade procedure. Cosmetically also, it was better for this patient. This is a pre-treatment picture, and even after 1 year, we have yet not received any post-operative recurrence, and the patient is stable with us, and he does not have much epiphora. So further plan is that we follow the patient 3 monthly. We can repeat intralesional bleomycin injections if any recurrence is noted, and we can take up the patient later on for cutler blade procedure or any other excision biopsy plans. So various studies have been done for various tumors like BCC, squamous cell carcinomas, and keratoacanthomas, and bleomycin has given 98 to 100% cure rates as well. So the take-home message is that mainstay therapy is always going to be surgical wide excision for these tumors, but intralesional bleomycin gives us the benefit of debulking the tumor mass, decreasing recurrence rates, and even handling the positive postoperative margins. So we could not get a frozen section done while we were doing the excision. It wasn't available in our institute. But it also helps in postoperative margin. Even if it's positive, we can go for intralesional bleomycin injections. And side effect profile is also very low, noted with the intralesional injections. So we can conclude that it's a very good and effective therapy, and more studies need to be explored regarding this. Simple solutions can sometimes give really remarkable results. Thank you.
So you just did the lamellar excision of
Yes.
the lesion.
Yes, sir. As much as we could visibly see, we excised the tumor, and at the base, we gave intralesional bleomycin as well.
And was
intraoperatively.
what was the base on histopathology? Was it clear from the tumor?
So that's what I told, because frozen section facility was not available.
We
Yeah,
don't need
after
frozen
we.
section. On histopathology also we can say.
Yes, sir. Yes, sir.
So that was clear.
Yes,
Base
sir.
was clear.
Yes, sir.
There was
The
no invasion
yes,
into
sir. The histopathology later on was clear,
Okay.
and recurrence was also not noted. As yet, the patient is on follow up with us, but yet the patient is stable in 1 year. Thank you.
If at all there was a punctum involved or
Yes, sir.
the canaliculus had a pigmentation, so
Yes,
what would
sir.
have you done for this case?
Sir, the punctum was initially involved, but we could have gone further with the
Involved in the
injections
sense?
only.
Involved means it was pigmented? Or
Yes, sir.
How we were saying like?
Sir, it was pigmented, but initially the syringing was, the punctum was also affected. It was, the tumor was pushing the canaliculus, but after the injections, the punctum was visible and the canaliculus was also patent. The injections really gave us an extra edge.
So
in
generally
that
there is a
case.
dictum that if the canalicular system is involved,
Yes, sir.
you do DCT in those cases. You have
Yeah.
to do extensive
Yes, sir.
excision of those tumors.
So actually we could not take, because before, as I said, that pre-treatment, we did not know that if the canaliculus is involved, but because it improved and syringing was patent,
It's not
that's
about
why we
the
did not go for
patency
excision of
the
that thing.
canalicular system.
Okay, sir.
It's about the involvement of the system.
Okay, sir.
It
If
won't
it is,
occlude
then-
it, but it will get spread.
Dislodge.
Yeah, further erode the bone and all, and it may spread.
Yes, sir.
So advice for this case will be
Yes, sir.
keep a long-term follow-up,
Okay, sir.
at least every 6 monthly,
Yes, sir.
and do have a ENT checkup as well,
Okay, sir.
endoscopy.
Thank you, sir.
Thank you.